Um, all right. We are live. Okay. All right, so everyone, thank you for joining us today. So today, the Starfish Foundation, in partnership with New York City Health and Hospitals Corporation, is holding this hangout, which we are calling the Doctors In, because these are two women with a lot of women's health knowledge and experience. So they're going to be talking to us about various topics that you guys sent in. Girls who had attended our Powerful Summit sent in. So we have Dr. Monique Collier-Nichols, who's the Chief of Adolescent Medicine and Pediatrics at Lincoln Medical and Mental Health. Wow. And we have Elet who is the Assistant Director of the Teen Health Improvement. So both of them obviously have a lot of knowledge about young women's health. So ladies, do you want to give a brief intro and background, just what you do exactly and maybe how you got there?
Sure.
Great.
Okay. So, like Catherine said, my name is Monique Nicholas. I am an adolescent physician at Lincoln, and I've been there for about 4 years. So as an adolescent physician, I take care of adolescents for adolescent problems as well as primary care. So, for instance, I could be the regular doctor for an adolescent that you would come to me for vaccines, you would come to me if you had, to get a physical, if you have a sore throat, if you, any reason you would go to your regular doctor. I see adolescents for those issues. However, I also specialize in adolescent issues, like for instance, females with menstrual problems, cramps, irregular periods, teenagers that need contraception, birth control, teenagers that want STD or require STD testing. Those are some of the more adolescent-specific problems that I see patients for.
Hi, my name is Elet. I'm Assistant Director of the Teen Health Improvement Program. I've been here at HHC for about 2.5 years, and in my role currently, we work to just improve services for adolescents across the corporation and the 11 hospitals, 6 diagnostic and treatment centers, and make sure that you are getting the quality care that you deserve. I've been in healthcare now for about 15 or 16 years. I started out as a health educator. I left. I started doing some publishing things. I worked in the publishing world for a little while, then came back and continued with healthcare because I realized that was my passion. And I felt like, unlike Dr. Collier, I couldn't do direct patient care, but I wanted to be able to provide care for patients in a different way, and so I work more on the administrative side. So that's what I do.
Great. Okay. Thank you, ladies. And so just to give a little background on HHC, who joined us at our Powerful Summit in July, they are the largest municipal healthcare system in the country, which is crazy. And they, take a progressive leadership role in providing healthcare regardless of one's health insurance, their ability to pay, their immigration status. They really just want to provide healthcare for everyone. And so it's a very patient-centered group. And so these two lovely women are a part of that group. And so all right, let's get started. Let's see. We have a lot of general areas we can cover in women's health. We could go on for days about it, of course. And some of it's been based on your feedback and questions we've gotten. And so I know some big ones are going to be like nutrition and access to healthcare is a huge one. Stress and sleep and cancer and going into the healthcare field. So does anyone want to shout out a topic to start with? Anyone? Any of you? Go ahead. You can do it.
Not all at once.
We really should make sure this is catered to what your interests are, because
yeah, I mean, you want them to talk about things you actually want to hear about. So, go ahead. No. All right. Well, I'll start then. I'm a young woman. So I would love to hear about stress and sleep and managing that sort of thing, and just tips for that, and how to manage your stress and sleep well and all of that, especially as a young person with a busy schedule. So,
yeah. So I would actually say that sleep is very important, despite what you might think or be able to get, how much sleep you're able to get as a college student. There's not a requirement on how many hours of sleep are needed for each. It's an individual thing. I mean, we generally say, anywhere from 6 to 10 hours of sleep is the average amount of sleep that a person needs within the day, but, it basically can vary based on your needs. What I would recommend, there's some questions here about how you can compensate for lack of sleep. I know during college, you're sometimes pulling all-nighters, you're sometimes partying, and you might not get that 6 hours, you might get 3 or 4 hours a night. I would try to compensate it by, taking a nap the next day if you can, or trying to, not that you can totally make up for the missed sleep that you have, but you can a lot of times feel better if you get your sleep in, because when you tend not to have sleep, then your body just isn't, it doesn't feel the way it does when you're rested. There's a couple other questions. Can stress and the lack of sleep cause your hair to thin or fall out? Sometimes it can. This is an individual thing. Basically, stress and lack of sleep affects people in different ways. So if you're ever feeling side effects from lack of sleep as well as stress, then you always want to seek the help of a healthcare professional, so that you could, break it down into trying to see what exactly is causing some of the side effects that you're feeling, because, yes, stress could cause that, but also medical issues could cause that also. So as much as you can, you don't want to self-diagnose. You want to try to seek out care from a professional, and then they can cater to your needs a little bit better.
I agree. And I think the other that was well said. And then I think the other thing, the other important thing is to try to reduce your stress, is to manage your time better. I think we all are guilty of, or some people more than others. Speaking for myself, I procrastinate a lot, and the stress comes when the deadline comes, when you got to get stuff done. And I find that if we try to manage time better, just like setting aside, like I know in this hour I'm going to do this thing, I'm going to try to put an hour and a half aside to do this. It just helps to make the day go smoother and just reduce the stress, because you know that you've set things up so that you can be successful and get things accomplished.
Great. Okay, that's actually really helpful to hear. Obviously, we worry about what stress is going to do to us, both mentally and physically. So another topic I know I had been mentioned to me by a few young women was nutrition, and what vitamins. I mean, should we be taking vitamins? Should we be, how should we be getting our green leafy vegetables, and especially if you're on a college campus and maybe you don't have as much choice in what you're eating, what are your suggestions for that sort of, staying healthy, staying on good nutrition?
Okay. So you definitely want to make sure that you're getting all the nutrients that the body needs. So there's a few different, there's different ways to get that. If you're getting it through the foods that you eat, through your four food groups, as well as different types of vegetables, like you said, your green leafy vegetables, provide a certain source of macronutrients to your body, as well as fats, carbohydrates, protein. You want to make sure you're getting a little bit of each. If you're not getting the food to provide the nutrient, then that's when vitamins can be helpful and utilized. I would not say to replace the foods with vitamins if you can actually eat the foods, because it's not necessarily better for you, but it's just more practical to actually eat the food. But if you're not, say for instance, I have a lot of teenagers that don't really like milk and don't really do a lot of dairy. So if you're not getting milk and dairy, that's a huge component of calcium that you're missing, and you need calcium to make your bones strong and keep your bones healthy and strong. So I always recommend, if you're not doing any dairy or milk, you should take a calcium supplement. However, the ideal thing would be to actually eat the milk and dairy. So that's pretty much it.
Right. Yeah.
And talking about, again, nutrition, for a lot of young people, they don't have a lot of money to like go to Whole Foods or something and spend a lot of money on these like really great vegetables and fruits and this stuff that's organic and really good for you. So how would you suggest that, the average person, get these good things when it's easier to, go to a fast food place or something?
Yeah, that's a good question.
That is a very good.
So yes, produce can be that can be one of the most expensive things in the supermarket. And yes, I have a lot of patients that come to me saying, I can get a head of lettuce for $5, or I could get like 5 McDonald's cheeseburgers and I could feel full afterwards. Not that, you would get the McDonald's cheeseburgers, but sometimes it just, what is going to make you satisfied and feel satiated is not necessarily the most healthy thing. So what I do recommend, I know that like a lot of you are in college, dining halls, most dining halls nowadays tend to be pretty good in offering a variety of foods, and you guys can correct me if I'm wrong, please, because you're there, but sometimes just go to the dining hall and maybe grab some of the produce, because I know personally for me, when we were in college, they had a salad bar, and I might not want everything from the salad bar, but I could grab my fruits and the things that I wouldn't necessarily want to buy from a store. I could do that, or I could actually go to late night dining hall and have like mozzarella sticks and wings and all the things that are bad for me also. So I think, it's a matter of you kind of making the right choices and not necessarily going with, all the time what makes you, what you want to have. You have to think about what's better for your body. I don't know what I would say in terms of, the Whole Foods because it's a financial issue, but try to make a way to get the healthy foods in, whether it be go to a sale, clip coupons. There's ways to get it. It's just that you have to sometimes consciously think about how you're going to make it happen.
Right, and if you prepare it yourself, that helps a lot. And personally, I'm just use myself. I know that it's much easier. The time that it takes to, if I prepare things over at night and make little bowls of whatever it is, and then take it with me, it makes it easier to eat healthier. While it's more fun, and seems like it takes less time to just hit the restaurant. If I plan ahead of time, it makes it easier to eat healthier.
Absolutely. Do you all find that your dining halls are offering a variety of things? I want to make sure that we're actually speaking to your situations. That's why I asked.
Yes.
If somebody could jump in.
I
see a nodding head.
I see that.
Anybody else? Yes, no?
Are you guys? No, I'm not in a dorm room, so no.
No? Oh.
Yeah, we have some women on here who are a little older and living, out in the world, and so again, that's another challenge of, as you were saying, balancing your, wanting to eat well with your, well, what can I afford, kind of thing. But as you said, it sounds like it's really just a personal, like you have to really work at it.
And priorities.
Right.
Exactly.
About catching the sales, really.
Right.
Trying to find the sale that has, from place to place, and it's annoying because I don't like looking in those little circulars, but you can find deals and then, work with what you've got.
And so obviously finances play a huge role in health, just in general, from there to paying to your for your doctor's appointments if you're sick. If you have to go to the hospital, all these bills kind of add up to taking care of yourself. So could you guys just maybe talk about healthcare a little bit and just talk about options as you get older, if you know from your experience, and just kind of maybe how to navigate. If you have any suggestions for navigating that sort of path of healthcare, which is very difficult.
So I'd say so it would be, I'd say it's important to see your doctor at least once a year, to see them once a year. If you have a more serious condition or a chronic illness that requires you go more frequently, then by all means you have to do that. I think so if you don't have insurance, there are city hospitals that will see people regardless of their insurance status.
Like
and then,
HHC.
Like HHC, we see people regardless of their insurance status and regardless of their immigration status. And those places will also help you to enroll in your own insurance plan. But if you're unable to do that, they also see you on a sliding fee scale. So according to the money that you have is what they'll charge you. And if the money that you have says that you can't be charged, then they won't charge you. It's not something that everyone publicizes because, of course, everyone likes to get paid. But the idea is that we want everyone to receive quality care, and so they will see you regardless. So I think that's important, and I think a lot of people are unaware of that, and you should be. You are you will receive care regardless, and you should seek care. There are things that you shouldn't let certain things go because you're like, oh, I don't know. Yeah, so I'm having a problem walking, or my knee is hurting me. I'm not going to look into that because I don't have insurance. You can go in and be seen, and then they'll work out payment plans. So everybody has access to care.
And there's a lot more options now because of the Affordable Care Act that was just instituted in the country. It differs by state, so it really depends on what state you live in as to what some of the parameters are for seeking out health care and getting access to health care. But if you look up, just Affordable Care Act, steps to get insurance in your state, then you can probably Google it. You can find out information for your particular state on as to what you need to do. As far as some other questions that we have that I just want to address, there's one question: when does my health care coverage under my parents end? If you have private health care insurance through your parents, then based on the Affordable Care Act, most of them don't end, I think, until age 25 or 26. Again, don't quote me on the exact age, but it's a lot longer in terms of the period that you have coverage. And I think that actually the Affordable Care Act has been the most beneficial for young people because basically, in the past, you get cut off from your parents' health insurance, earlier, I think 21 or 22, but now it's extended. In addition, there's so many more options available to seek out healthcare insurance. So in addition to what Elet was saying about there being sliding scale fees in different type of public institutions that provide healthcare for free or at a reduced cost, you also have more options in terms of healthcare insurance. In addition, for specific types of issues that you might have, for example, contraception, there are definitely government funded programs that support giving out free contraception. It's Title 10 family planning clinics. Anything that falls under that window, you could go to that particular institution and usually receive free contraception, as well as STD testing. So what I would recommend is if you're unsure on, whether your insurance is covered or, whether or not you can get contraception, is just kind of trying to see what the rules are in your particular state. I find a lot just by Googling, terms a lot that I need help with, and I know that for that, like, for instance, my brother lives in California. He's on some sort of healthcare plan from California. We basically Googled it, found out the steps he needed to take, and then he went to the office to get insurance. So, sorry, that's a lot of information, but access seemed to be a big question here. So we wanted to address how to get what you need in terms of healthcare.
And then also with the ACA signing up with one of the insurance plans, you may feel like I can't afford this, but based on your income, if it seems out of your reach, they do supplement the cost of the healthcare insurance plan. So it's possible, it's workable. There's always like a little, you know, round, you can get around things and get the care that you need.
And if you live in New York City, then you could come to the HHC institutions, because we can provide the care that you need either through the insurance that you have or at a reduced cost, or, you know, depending on your financial situation, because we see people regardless of financial status.
Right. And then also, there are other, sorry. And then just for, Monique was saying, for reproductive health services, there's a particular, in New York, it's called the Family Planning Benefits Program. And that basically covers all reproductive health services, anything from the waist down for both men and women. So you can sign up for that. It's free of cost. You can even sign up for that if you're already on your parents' insurance. It's the supplemental insurance, and get the care that you need.
Any questions on that? We just gave a lot of information about access, so I want to make sure we're answering your questions. Anybody have questions, feel free to jump in.
Yeah.
We want this to be interactive if you have questions. We don't want to just be lecturing to you. Hopefully it doesn't feel that way.
I'm not a lecturer.
I have a question, but it's moving on to the one of the next subjects, cancer.
Okay.
So
Okay.
about the HPV vaccine, I just want to know, it's you know, relatively new. Is it something that you would recommend for your patients and for your daughters or nieces?
Absolutely.
Yes.
Absolutely.
It's actually been around for some time now. I think there, I'd say at least 7 or
Yeah, I think
7 years.
early 2000s.
Yeah, early 2000 it came out, so it's been around for quite some time. There were changes made, so originally it was just for young women. Now it's available for young women and young men. HPV is one of the most common or if not the most common sexually transmitted infection. And while in certain strains the body can clear it itself, there are other strains that are definitely more dangerous. And rather than cross your fingers and hope you don't get the dangerous strain, it's much easier to just get vaccinated and play it safe.
It protects against cervical cancer in addition to genital warts, the certain types that cause those two things, like Elet said, that are the more severe kind. So basically it's a 3-shot series. Mm-hmm. You can get it anywhere from age of 9 to 26. We recommend it within that age range. It's 3 shots, one when you come in, the next one in 2 months, and then the next one 6 months from the first shot. And it's definitely, we recommend it. It's actually on the American Academy of Pediatrics immunization recommendation schedule. So it's recommended by the Academy of Pediatrics, by the by multiple organizations. So we encourage it. Absolutely. And I would encourage it for my daughter. Mm-hmm. If I would have been able to get it myself,
I would have gotten it myself.
I would have, but I was past age 26.
By like a day. No, that's a lie. But yes.
And speaking of the HPV shot, so obviously since it is a newer thing to give to young women, they don't know the long-term effects, correct? So is there ever concern about, because I know a lot of parents, not a lot, but there's, you know, a subset of parents who don't want to give their children immunizations because of potentially what it could do. So would you say, from everything you've read and heard and seen, would you say HPV, that shot falls in there, or do you think it's fine? And what's your thoughts on all of that?
I think that in general, most vaccines are very, very, very safe. There are very few long-term bad side effects of immunizations. For the most part, they're protecting you from diseases that would be much more severe if you did not, or, you know, could potentially be fatal if you actually get the disease that it prevents. So even though there's not long-term, there actually are more long-term studies, because before the before the before the vaccine got instituted, you basically needed to do different phase trials in order for it to be FDA approved. So in those trials, there were no significant long-term side effects that would prohibit us from giving the vaccine, where there were positive long-term side effects in that it prevents anal cancer, it prevents cervical cancer, and it prevents the genital wart strains that we talked about. There are potentially some minor side effects of HPV vaccine, but it's usually most vaccines across the board in that you're probably going to have some tenderness at the site of injection. For HPV, sometimes it's a little bit more associated with syncopal, which are fainting episodes after the vaccine itself, a little bit more than other vaccines. However, it's a little bit skewed in terms of the reason for that, because most vaccines are given to kids as opposed to adolescents, and adolescents might be a little bit more likely to faint than a child. So it's a little bit skewed as to why that happens, but you know, we basically observe patients after they get the HPV vaccine. As long as you're doing well within 20 minutes, then you know you're usually fine. So usually you can pretty much say with most vaccines, including HPV, that the benefits far outweigh the risk of getting the vaccine, which is why we recommend it.
Great, good, good to know. And so I know, continuing the conversation about cancer that Tiara brought up, I know that is obviously it weighs on everyone's minds these days, because you feel like everywhere you turn, you're hearing a new case of this person has this cancer and there's this cancer and all the different types. So for, young women in high school and college and post-grad, under 30, what should we be looking for? What should we be doing? What would you suggest that we do to just do our best to live a healthy life and try to avoid cancer if we can?
I would say that you should take advantage of all the screenings that you're supposed to do. So once you reach the proper age, you should get you should be going for regular GYN exams as is required. I definitely want to say that you should be doing self-breast exams, because if you catch something earlier, the better. Is everyone familiar with how a self-breast exam goes? Nope. Okay. So, the best place, the easy place to do it is in the shower, because your skin's wet, so it's easier to slide your hands over your body. You want to put one hand up over and follow your breast, this way, and just adding and you're feeling really for lumps, anything that seems abnormal. You don't want to do this right before you get your period, because there are lumps that happen automatically that are normal, natural things that the lumps will come. And then, so you'll follow around in a circular, coming all the way till you get to your nipple, and you're just going to squeeze the nipple, not hard like, ugh, but you're just going to apply a little pressure to your nipple and see if any fluid comes out. That shouldn't be the case. And you want to do that with both breasts. It's like I said, it's easier to do in the shower because your hands slide over your skin easier because you're wet. And you should do that. You want to check once a month for lumps, and also under your arm, under here in your armpit. You want to check there also, and make sure that you're aware. The other thing is, and then just look at your breasts. One's going to be maybe, you should be aware. One may be bigger than the other. One may they may have some slight differences, but there shouldn't be any strange dimpling in the breast. It should just be pretty smooth. And you want to look at your body, be aware of what your body looks like when it's healthy, so that you know what it looks like when it's not. I don't know.
A couple of the things. So for the most part, in terms of most types of cancers, for the most part, adolescents are at a very low risk for most types of cancer. So even with breast cancer, the likelihood that you have breast cancer during the stage of adolescence is very, very unlikely. So if you have a family history of breast cancer, it puts you a little bit more risk, but that's why the recommended age of mammography is not until age late 40s or 50, I think. So that's not something that I would be really stressed about. Stuff like breast exams are great. However, the likelihood that if you find a lump or something weird, you get it checked out by the doctor, and usually it's probably not cancer. So I don't want you guys to be totally alerted to say, I think I have breast cancer, because the likelihood that you have it is very, very, very low. So like Elet said, the best thing for you to do as a teenager or a young adult is to continue getting the screenings that are offered, as well as yearly checkups, just to make sure your physicals are okay. There's no weird history that would suggest that you would have, some rare cancer or some, sort of disease or disorder. For the most part, children and adolescents are generally healthy. Of course, you have your rare instances of cancer or a certain disease or, something that, makes you seriously ill. But for the most part, most kids as well as adolescents are healthy. But it's important, though, to get your screenings and to get your yearly checkups. For something like a gynecological exam, although we used to do pap smears, which were the screening for cervical cancer, we used to do those 3 years after you became sexually active. It was actually recommended now by the American College of Obstetricians and Gynecologists not to get that screening done until age 21, because we found that we were doing them on teenagers, and because they had immature cervices, which is one of the organs in your vagina, they would have changes on their pap smears, but they wouldn't be cancerous. They would just be kind of something alarming, and then you would repeat it, and then you would do the procedure, and then they would find that you don't have cancer. So rather than subject teenagers to this unnecessary exam, they basically move the age up to 21. So that's something that a lot of teenagers asked about, because they say, oh, my mom tells me I need to get my pap smear. You actually don't need to get a pap smear until 21 now, regardless of when you had sex for the first time. I hope that makes sense.
And could you guys maybe talk about actually cancer in different races? Is a certain type of cancer more prevalent in one race versus another? Should African American women be looking for one thing, and maybe Caucasian women looking for another, and Hispanic women looking for another? From your experience, if there's any difference.
There actually are differences by race for different types of cancer. I'm not prepared to talk about, the exact rates and which are more common in different populations, because like I said, for the most part, that's more adult medicine, which, I know by just, general knowledge, that this is true, but I don't want to give specifics because that's not my area of expertise. But like I said, as a young adult, I would just worry about the screenings, and then once you see an adult physician, then they'll be more inclined to test you for what is more particular to your race or your family history. Or even your family history as a young person will be more inclined to, take that into consideration. But for the general population, we generally don't do as much cancer screening in the realm of pediatrics and adolescents.
There are a lot of differences in outcomes across races, because the races or different ethnic groups access care differently. So I think the take-home message would be to make sure that you go for regular screenings and follow guidelines or follow the instructions of your providers, so that should something come up, you can catch it earlier rather than later, and then move on from there. I think that's the take-home message there.
So, like, for example, in particular, African Americans are more likely to have end-stage renal disease because of hypertension, but it's because they do not come to the doctor in time to be able to treat their hypertension, that it proceeds to end-stage renal disease, and that leads to dialysis and other kidney issues. Right. Whereas if the hypertension is taken care of initially at the right time, then you won't progress to that stage. So it's all about, a lot of times, about access and accessing medical services.
Does anyone have questions about cancer? I know that is such a fun topic. Any you ladies? Well, another topic that I know is everyone's thinking about and talking about and reading about is Ebola. And I know that your third panelist who was supposed to join us is now an Ebola czar at her facility. So I was hoping you guys could maybe just, if you feel like you could, just address Ebola and just address, you know, what you should look out for, but maybe why you shouldn't panic about it necessarily, and maybe why the flu is something you should be more worried about than Ebola. Yeah.
So I want to. Okay, so it's the way we've been seeing things in the media. It's very easy to get worked up and not want to ride the train or touch anyone or have anybody near you or wear gloves. So, but that's not the response that we should have. I think it's important to know that, as I said, it's transmitted. It's not through the air, and it's through bodily fluids. And those bodily fluids from a person that's infected has to come in contact with a mucous membrane. And what your mucous membranes are the pink areas on your body. So like this part of your eye where it's pink, that's a mucous membrane. Or inside your mouth, or if you know, other places that are
if you have sex with the person,
yes,
the vagina is a mucous
membrane. Is a mucous membrane. So all the pink areas. In casual contact with a person, it's very difficult to have their personal bodily fluids come in contact with your mucous membrane. So it would be hard for the disease to be transmitted that way. So the likelihood of the common person coming in contact, with someone in the United States coming in contact with a person who had Ebola and was able to get their bodily fluids onto your mucous membranes is very, very small. So the risk is super tiny right now.
And the risk of somebody having the infection is, unless they traveled from one of the 3 countries where it's endemic, Sierra Leone, Guinea, and the other one is
Liberia, I believe.
Liberia. Good story. Liberia. If you come from one of those 3 countries and you've been exposed to somebody or had a fever within the last 21 days, those are the people that are at risk. So the likelihood that you're going to be in contact with one of those people is very small, you know, from the get-go. And then, like I said, it's very hard to, like Lilette said, it's very hard for it actually to be transmitted. Of course, if this is the case, then you are able to protect yourself with, you know, not coming into contact with their bodily fluids or using some sort of protective gear. But the only reason you would probably do that is if you were a healthcare worker, unless this was a family member. And a great sign is that the young man who passed away from Ebola in Texas, his family members didn't even get it. So that shows you how hard it is to actually transmit. However, as Catherine said, you should be much more afraid of something like the flu, because unlike Ebola, flu is transmitted through respiratory droplets. So that means that these droplets are in the air. If somebody has flu, which could be, you know, multiple people in the United States, it doesn't, you know, it's not coming from one area of the country. If you get the flu, then you are likely to get sick. How sick you get, it's really dependent on the strain of the flu, your your status in terms of, you know, being sick, healthy. Also, if you've had the flu before, if you've had the strain before, you know, there's multiple factors, but people can get really sick from the flu if the right presentation occurs. So it's better to worry about something like the flu and get your flu shot, as opposed to worrying about something like Ebola, which is going to be very likely that you ever have any contact with.
And then, you know, it seems really simple, but you should just wash your hands. Wash your hands when you come inside, after you've been traveling. It is, you know, we see doctors wash their hands all the time, and there's a reason for it. So you should just wash your hands. Keep clean, and you will, the likelihood of transmitting or getting any infections lowers when your hands are clean. Yep.
So would you recommend flu shot for everyone?
Definitely.
Yeah.
unless you've had some sort of reaction to it in the past or you have an egg out. There's specific contraindications to it, but generally most people are eligible for it.
Okay, and there are the different...
Actually, asthmatics. If you have asthma, you're more likely to get very sick from the flu, so you should absolutely get a flu shot if you're asthmatic.
Okay, and there are different ways you can get the shot also. You can get the shot or you can get the nasal thing. So is there really a difference in those two? Would you guys recommend one over another?
I don't think there's any difference in the efficacy of either. There's difference in the components. One is a live vaccine, so the nasal flu mist is actually getting a portion of the vaccine, and that small portion will give you immunity to getting another strain of flu that will cause you to become more sick, whereas the injection is an inactivated vaccine, so it's the so-called dead virus. They do not recommend the live virus in somebody that's immunocompromised or who has asthma, whereas people that don't have any of these issues could get either one. It all depends on preference as well as availability at the particular institution that you go to. But they have the same efficacy.
So do we have any questions that we want to bring up, as we are starting to wrap up here? Obviously, these ladies know a lot, and they can really cover a lot of different topics. So please feel free.
And it can be off of the, things that we've talked about. I know there were some things about just medical school and health careers, appearance.
Right. Body image stuff.
Body image, miscellaneous.
Erica, are you trying to ask a question?
Huh?
No, maybe not. Oh, I think your sound is not working.
Oh, yeah. I think you should ask a question also about your sound. Maybe you can unmute yourself? I think
now she's muted.
Okay, now you're muted. Wait. Now you're unmuted.
Okay.
Talk now. But it's not working. Is your microphone on your computer? Oh.
Can you type out your question on the side?
I was going to say maybe you could write it on a piece of paper or type
and hold it up.
And hold it up, and then we'll answer. We'll go back to...
Well, while we're figuring that out. Do we have any other questions from the other ladies? This is obviously a really important topic, especially as you get older. It's really important to know your body and take care of it and be nice. Do you guys, what are your thoughts on, for example, like yoga and Pilates and meditating? Would you recommend that for these young women who are super busy and super stressed?
I think whatever positive activity that you can do that relieves your stress and can also be helpful in terms of exercises is great. Yeah. It all depends on your personal preference. Some people enjoy running, some people enjoy cooking, some people, whatever is that thing that is your passion that you love that can, be a hobby or a stress reliever, I would recommend it.
Yes.
Because you need outlets. It can't just be all about work, school. I am definitely a proponent of you work hard, but you play hard too. You play safely, but you play hard, because you're working hard. So you should see the rewards of your hard work.
Definitely.
And Erica's question came through in the chat. So she asked, what's the right age to start going for mammograms?
I think it's 40. Between 45 and 50, but I'm not sure. I don't remember. I'm sorry.
Unless you have a history of breast cancer in your family.
Right.
Then they recommend it earlier, but otherwise, it's not until much later.
And then how often should you be getting them after that? Is it every year, every few years, every 5 years?
I'm not sure about that. I would actually recommend, especially since this is Breast Cancer Awareness Month, I'm sure you can find that information by the American Cancer Society or someone, because it's such major news right now because it is Breast Cancer Awareness Month. I would look it up on a reputable site like American Cancer Society, and I'm sure you will find the information. unfortunately, I'm not sure of it, and I don't want to give you erroneous information.
Right.
So yeah, just as we wrap up here, so HHC is obviously this really great place that is, trying to just help people. So would you suggest for those who aren't in New York City, should they just like Google and try to find a place like HHC in their area? I mean, is it the kind of thing that can be found across the country, or what's the what should one do?
So every state has a city has city hospitals, and those hospitals are more affordable for people who are underinsured or uninsured. Can I speak to could either of us speak to the quality of those facilities? I cannot. I can only speak for HHC. And the quality of care that you will receive at one of these facilities, I know is excellent, and I feel confident saying that. But every state does have a city hospital, and there are also, and the other thing is, aside from the city hospitals, there are community-based organizations. So there are community-run healthcare clinics that you can utilize and get the same type of care if you don't want to go to a larger hospital, you're feeling a little uncomfortable, because that can be a little daunting also, going into like this big hospital and you don't know exactly where to go or who to speak to. The systems often are not set up so that they're friendly and warm and welcoming. So there are other smaller organizations that you can go to that will offer the same type of care and are more accessible to you. So
you could actually start off by looking at Title X family planning clinics, because those are government-funded clinics all throughout the state that service adolescents and women for reproductive health. So that is can be your first look, and then maybe you could go from there in trying to find something that is more that suits your needs, basically. But I mean, that's a good start, because they're everywhere, as opposed to you don't know the names of some of the city hospitals or municipal systems where you are, or something like looking up adolescent health services. Generally, if they provide preventative care, contraception, they are providing adolescent services, healthcare services, but you really have to do what meets your needs in terms of, is it accessible during the hours that you can come? If you want a female or a male provider, do they have that? Are they taking your insurance if you have insurance? If you don't have insurance, are they, providing you with some sort of, options in terms of, reduced fees or like a sliding scale like Elet talked about. It is a little bit of a search, but most places in the United States you can find adolescent services. It's just, unfortunately, and you can also get recommendations from other friends and people, or sometimes in your area, it's a matter of just talking to people in your area. Another big thing that I forgot about is college health. Most colleges have a college health center that can provide these services. So if you have a college health center, I mean, I remember going to my own college health center for a lot of my needs as an adolescent that I, didn't want to have to go home. I went to school in Maryland. I didn't want to have to go home to Pennsylvania to, get a flu shot. So college health services can be pretty comprehensive also. So utilize that as an option.
Great. Okay, that's very helpful. So I think we have one more question that we can close it up with, but from Tiara. So go ahead.
Yeah, so I know that several of the young ladies that are live and probably that are watching want to go into the medical field. If y'all could share with us your paths to medicine, that'd be awesome.
Sure. Okay.
So I'm going to start with the less medical. In undergraduate, I actually really did want to be a doctor, and I was on the path. I had started applications to medical school, and I realized that the amount of studying required was not something that I was prepared to do. And so it took me a little while, but I wanted to find another way that I could help people get quality care or provide care for people without having to go to medical school or nursing school. And I came across public health. And what we do in public health is we look at, instead of just focusing on one person, we focus on the entire population. And how can we change the outcomes of healthcare for a population so we get to help more people and help the people that do the more focused care deliver that care in a better way or optimally. So that way, the work that I do makes sure that Monique can do the work that she does to the best of her ability, because I make sure that she has the services. I make sure that the policies are in place. I make sure that the people know that she is here and can provide that care. And so for me, this was like the best of both worlds, because I get to interact with her, but then not do the stuff she does. And so I think it's also, I think it's really good that we know what our limits are. We know the things that there's different paths. Not everybody has to be on the same path to be successful, and that there are tons of options. And we're not all going to do things the same way, but we will be successful. And it's really about being happy and feeling, having a good feeling at the end of the day. I won't lie and say I leave work every day like, yeah, this is it. That's not true. But I do feel good about what's happening and the results that I see. So that was my path.
So I totally have to agree with Elet that there are absolutely different paths to get where you want to get, and different roads. Some of the roads might be straight, some of the roads might be curvy. So for instance, myself, I talked a little bit about this at the Powerful Summit, so if you've heard it before, sorry, I apologize, but this is kind of my story and my path. So I grew up in a small town in Pennsylvania. I went to college in Maryland, College Park, Maryland, and when I went to Maryland for college, I was a journalism major. My intent was to do something big, but not quite, I didn't quite know what I wanted to do. I had thought about maybe like a magazine for teenagers, specifically African American teenagers, because I felt like growing up, I really didn't have a lot of access to things like that back when I grew up. There were no, like, there was like Teen Magazine and 17, but there was nothing really, that talked about my hair and like the makeup that I needed to use. So I was like, oh, adolescents need something for, African American teenagers. But then when I went to Maryland, I was journalism majors, and I'm like, you know what? I really don't like to write that much. So I don't think that being a journalism major is where I need to be. So I was always really good and strong in math, and I was like, okay, I'm just going to be a business. I had an internship through a program called Inroads. So I was like, let me just be a business major, just because I know that's something I can do. It's easy. It was not, so hard for me. So I was like, I'll just do that and then figure it out. So I became a business major, and I still had my internship during the summers with Inroads. And then I was like, you know what? Business isn't really so fulfilling for me. Like, I don't feel rewarded. I don't feel challenged. It has really nothing to do with, like, changing the world or doing something big, as I thought. Although, there's plenty of things that I could have done in business that were big, but it was just my frame of mind at that time. It just wasn't, I wasn't feeling it. So then I actually I took a science class, like micro class, and it was kind of pre-med, and I was like, oh, you know what, this is kind of challenging. I like this. Like, this is more science to do with, the body and medicine, and it was challenging to me. So I'm like, okay, I'm going to be a pre-med major now, also in business. So I did that, but then one of my other goals in life was I wanted to move to New York City, because I had grown up in this small town. I was like, I'm moving to New York City after I graduate, and I'm just moving to New York City. So I actually got a job in business as a consultant right after school with my business degree, came to New York, worked in consulting with a company called PricewaterhouseCoopers, and then I worked there for a while and enjoyed New York City, had an apartment in Harlem. It was just great because I enjoyed being with, I enjoyed the culture of New York City as well as my job at that particular time. But then after a year and a half, I was like, you know what, this really is not fulfilling. I want to go back to medicine. So I actually did some pre-med additional requirements, and then I went to medical school in New Jersey. I went to medical school in New Jersey, thought about pediatrics as a specialty, but really wasn't certain that pediatrics was it. But then I found out about adolescent medicine, and I was like, hey, this fits my needs in terms of wanting to work with teenagers. I might not have the magazine, but I still am able to work with teenagers. So I actually went down that path of medicine. So I did finish medical school, did a residency in pediatrics, which is the primary training you need to be a doctor. I did that at Columbia. And then I did what is called a fellowship, which is additional training for a specific subspecialty. So pediatric has lots of subspecialties like cardiology, pulmonology. Adolescent medicine is one of those subspecialties. So I did a subspecialty in adolescent medicine at a program called Children's Hospital at Montefiore, which is also in the Bronx, New York. And then I've been at Lincoln for the past 4 years after I graduated my fellowship, and now I'm an adolescent medicine physician. So I know that's a long, drawn-out story, but I just say it because I want you guys to realize, there's multiple different paths, to where you get to. Like, who would have ever thought that the journalism major, in high school would be now the adolescent medicine physician, journalism / business / pre-med, there's multiple different ways, so you can kind of choose your path and the direction you go. And if it doesn't, if it isn't the straight and narrow, that's okay. If you decide to go, if you want to go to college and you are one thing and then you say, oh, that's not really where I want to be, and you want to make a left turn, it's okay. As long as you're, still working hard at what you do and what you're studying, then it'll work out the way it's supposed to work out.
Right. And even later on in your career, I worked at Mount Sinai for a while, and one of the social workers who was was an excellent social worker. She'd been working there for like 3 years, 3 or 4 years there, and then she left, and now she's a lawyer. She went to law school, and now she's doing law. And the population that she works with adolescent, defending young women who are victims of sex crimes, and she does that work, and it's very fulfilling. And so her path also was not, direct. It was this curve, but she ended up where she needs to be. And I think we get very nervous if we're not. Well, my parents got nervous because they were paying for school, and they were like, "Figure it out, girl." But we get a little nervous, and we're worried about it. But it all works out. If you continue on the path, you'll eventually find out where you need to be. So.
Wow. All right. Well, that's awesome. It's so great to hear the journeys the two of you took to get where you are right now here with us. And thank God you're here. So thank you guys so much again. We are out of time for our hangout, but again, it was so great to have you. HHC sounds like an amazing company, and you guys are doing great work. And I know we all really appreciate hearing from you and getting a little bit extra after your big session at Powerful, which was obviously a huge hit there. And we look forward to working with you guys again. So thank you so much, and enjoy the rest of your day.
Thank you. You also. Good luck, everyone.
Bye, guys.
Bye-bye.
Bye. Bye.